There is growing concern a new tax on medical devices could end up costing tens of thousands of jobs here in the United States. The tax is part of President Obama's plan to pay for health care. But device makers are warning this tax will force layoffs, hurt the economy, and stifle innovation. Steve Brown has taken a look at it live in Chicago. This medical device tax, it's went into effect earlier this year, right? 2.3%.
It did.
Doesn't sound like a lot.
But that's on revenue and not profit or earnings, so it really has a larger bite than 2.3%. Then you have to factor in what happens in different size companies. For larger companies, they can lay off, and we've seen some of that out of the bigger companies. The smaller medical device makers, it's a different kind of impact. Have a listen.
We can't do what some of the big ortho companies have done and just lay people off. If we did that, we couldn't keep up with growth. But we can slow down the pace of hiring, and sadly, what we have to do is to cancel development projects.
Projects like the one that resulted in the ability of Bryce Lippe, also from Warsaw, Indiana, to be able to walk. He did this thanks to a surgical team and some innovative new products put together by device manufacturers. These smaller companies say these kinds of innovations will be slowed down, so it hurts them both on their bottom line and what they're able to produce, significantly different from all the larger companies that ultimately leads to their survival. John?
I know there's one town in Indiana that's really been hit hard by this device or this tax.
And it is Warsaw, Indiana. You wouldn't know it by looking at it, but almost 50% of the medical devices made in America and 35% worldwide are made in and around Warsaw, Indiana. A lot of those companies are the smaller type of company. And for folks who are local leaders, this new tax is a potential nightmare.
That's a tremendous concern. You have the companies like Orthopediatrics that it's really impacting their research bottom lines, and they're feeling a tremendous pinch. But even the large companies, the big three, are talking about the impact it's had.
Now, the president himself has defended the tax this way, saying the tax is necessary in order to pay for a portion of Obamacare, which expands health care, which is better for the nation. It also opens up a market of 30 million potential customers who will be covered under Obamacare. But device makers say that's not necessarily the case. Take folks that make replacement hips. Most of those folks either have public or private insurance now, so that added 30 million really doesn't have any impact on their bottom line. John?
Wow, Steve Brown, what a story. Thank you.